This lesson will focus on government influences on healthcare. This meets course objective number 8, exploring governmental influences on healthcare, and also the weekly learning objective outcome of identifying future trends in healthcare. So if we look at healthcare today, it's a mess, especially right now with COVID. But hopefully the improvements we see continue to limit the number of deaths that we're seeing. We're trying. We have seen a resurgence of old diseases. We've seen tuberculosis come back, measles has made a recurrence, whooping cough, which is pertussis. And then if you look at the history, new infections that appear, so HIV, AIDS back in the 80s, that still tends to resurface, it's still around. We saw Ebola and Zika coming forth, and then now we have the novel coronavirus 19. So things change, we work through them, we figure out what works, and we move forward. So when we talk about, let me go back one slide. I thought I missed one. There we go. So the importance of understanding the role of government in healthcare. What does government do for us or not do for us? So the government plays a role in promoting health and well-being of Americans, and then we hopefully can gain an understanding of and keep up on new developing legislation that will help us either access or make more services available, those types of things. So when we talk about standards of practice as healthcare providers, we have standards of practice. We have the Nurse Practice Act, respiratory care, physical therapists, speech therapists have different standards of practice, but they're foundations of the laws related to consumer protection. So before we had these standards of practice, or actually they came about because of consumer protection laws. And those went from the retail market into the healthcare market. And so basically what standards of practice do is they describe what the competent level of care is in each phase of the nursing process, like that guides and promotes our clinical practice. We go back to the Nurse Practice Act, to your state board. So a nurse in Ohio has standards of practice there. In California, we have our standards of practice. They're pretty much the same, but there are some things that are different here and there. And so what it's trying to do is it's reflecting that the nurse has, or the respiratory care professional has achieved a level of performance. It's a standard by what we can compare performance. So does this nurse over here perform the same as this nurse over here? Well, no, they do things a little bit differently, but are they within the standard of practice? Yes, they're both within the standard of practice. So you have a comparison there. And it's there to provide safety, to direct care, and to maintain safety, and have something to a standard for clinically competent practice. Also, you can look at the multidisciplinary healthcare team. So it's nurses, doctors, you can have lab techs, x-ray, social workers, you can have PT, OT, ST, caseworkers, discharge planners, I mean, even, nutritionists, things like that. And we're all supposed to come together to work towards the plan of care that is going to promote health. And if you're looking at a hospital setting, get the patient closer to going home, get them discharged. But you also have multidisciplinary healthcare teams in long-term care, in hospice care, in many different other situations, even in long-term care. So as healthcare professionals, you're working with a lot of people, and the government tells us, gives us the guidelines under which we can practice. So here's an example of the Nurse Practice Act. This is for California, it's the 2016 edition. So in the Nurse Practice Act, it defines the scope of practice for nurses. And then if you're respiratory care therapist, respiratory care, PT, OT, you have your own practice act available to you. And it gives you legal limitations and what the normal and customary skills are that are supposed to be practiced by nurses or other healthcare professionals in your profession. And then there's also in 2011 for nurses specifically, there's something called the Nursing Licensure Compact. So there's 24 states that state that if you're licensed in this state, then you're licensed in this other state. You don't have to, you still have to apply for your license, but you don't have to take an exam to become licensed in that state. So it's really good to get licensed in California because that carries in a lot of other states. So earlier I said that the Nurse Practice Act scope of practice went back to Consumer Bill of Rights and Responsibilities. And so we took that and moved it over to healthcare and the patient as opposed to the customer and the patient, although we still do consider our patients as our customers. So the healthcare system needed to be fair and meet a patient's needs. It had to give the patients a way to address a problem. So if there was a problem, there was a process to follow to help take care of that problem. And then it also encourages patients to be able to take an active role in their healthcare. It's really been interesting over the years. I've been a nurse 30 plus years to see patients that were rather passive patients, and now they're very involved in their care. Sometimes a little too overly involved, but that's okay. We deal with that. And so we do want them to know what's going on and have a say in their care and what's going to work best for them to promote health and prevent disease. So Minnesota was the first state to establish the patient bill of rights. And so that's what we have now. We have a patient bill of rights and a patient responsibilities. And so the American Hospital Association extended that and added the responsibilities. And then if you're thinking of patient's bill of rights, an example of that would be informed consent. So that's one of the most important rights of patients. So when you think of patients' rights, they have a right to a grievance process. They have a right to the best care to be provided. They have the right to be informed of any procedures that are going to happen to them, to know what the billing is, to know rules and regulations, all these rights that they have, the patient has. But they also have responsibilities. So in other words, they have the responsibility to disclose information that could affect the healthcare that we are going to provide to them. So we might need to know if they have a history of seizures or a history of drug abuse or something in their history that we need to know, or something currently going on that might affect the care that they could receive. So that is one of the responsibilities of the patient, to provide the healthcare provider with appropriate, correct information. So another governmental agency that comes into play is JCAHO. You heard JCAHO, Joint Commission on the Accreditation of Healthcare Organizations. And so this is how hospitals are gauged to have met their standard of practice. Now, JCAHO is actually, and I remember when it first started, you would call it the Good Housekeeping Seal of Approval, those of you that remember Good Housekeeping. But hospitals actually pay to have JCAHO come in and look at their hospital to make sure that they're meeting all the regulations. And so if the hospital does not become accredited, then they may not be eligible to receive state or federal funding. And most hospitals need extra money. They need to be accredited in order to stay open. So it's very important that when that the hospital is always ready to have the commission come. You generally know when they're coming. There's been a lot of memes lately going around that, oh, JCAHO's coming and the nurse is eating at the nurse's station, because you're not supposed to have food and drink in patient care areas. So that's been kind of funny. But you should always be working and acting as if JCAHO were there watching you, because you want to always be providing the best care possible for your patient. And then if we look at other acts that came to be, you don't need to know these, but just know that there have been, like the Constitution gives, we have the right to provide for the general welfare. They implemented WIC. They had different social welfare policies over the years. There's a picture of President Roosevelt signing his New Deal, which allowed for government spending for healthcare, public health, unemployment compensation, old age laws, and these are these are a long time ago in the 30s. And actually the United States Department of Health and Human Services, right, was renamed in 1980 as that. Healthy People 2020 that we just talked about, that it comes under the United States Department of Health and Human Services. And so under that department, the local, state, and federal government can provide direct services and financing, and they can set their own policy based on what the government says. You also have direct services that are provided by the government. So for example, Native Americans on the reservations have specific health clinics there. Military personnel receive specific direct services. Prisoners, many nurses, not many, some nurses choose to be to provide nursing services in jails, in the correctional systems, correctional nurses. There's pretty good money in that. Again, but those services are provided for prisoners, managing different screening clinics, immunization clinics. Those are all direct services that, that the government can provide to people. So the financing, so how does the government fund things? And so the government funds like health education programs. Again, I'll go back to the Back to Sleep program. Government funded that and finances the healthcare through Medicare, Medicaid, and Social Security. And they also can provide grants for research and education. But the Medicare, the benefits are received through payroll deductions. You'll see that on your pay stubs. It'll say Medicare, and then Medicaid are provided on the basis of need, and then Social Security benefits as well. We get those at a certain age or for dependent or on disability. We have those available to us. But there, there's a debate about should we have one healthcare system, or when we're looking at different how to make healthcare better and more affordable. There's also information that you can get, the National Institutes of Health, CDC, Centers for Disease Control and Prevention, and Health is another website that you can go to. Again, these are provided by the government for us. And then we move on to different types of policy settings. So what can the government do? What laws can they mandate related to health? So the federal law can mandate quarantine. So again, it was interesting because I've done this presentation for probably 6 years. And this is the first time that when I've gone over this slide and we're in a quarantine. So the federal law can mandate quarantine and specific health-related actions for the protection of its people, of its citizens. You also have OSHA, the Occupational Safety and Health Administration. So they're the people that make you wear hard hats when you're on a construction site, or have certain, if you have your little liquid paper, you have to know what the antidote to that is. Yeah, they do. They can do the draft selective service. They set laws for drinking and driving and working, like your 12-hour shifts or double time, coming back overtime. They can set policy on when you receive your Social Security benefits. And there can also be, on more personal levels, divorce, abortion, or custody type laws. So the government can do a lot. So when you're in healthcare, the cost of healthcare continues to rise, and I'm not quite sure how to make it stop. Different public health benefits like the Medicare, Medicaid, known as Medi-Cal in California, but because it's a state program, the state needs the funds to continue those, and it's very difficult sometimes to get the funds, and more people are being put on those programs, not taking advantage of, but signing up for those programs. And so costs increase every year. So here's a slide that compares Medicare and Medicaid, shows where they overlap and where they're different. So Medicare is the federal program. It's an insurance program, and Medicaid is, excuse me, federal and state. So it tells you how it's paid. The Medicaid programs differ by state, whereas Medicare is the same across the nation. Medicaid is for those with low incomes, whereas Medicare is benefiting people over the age of 65, although it could be, you could wait till you're 67, or there are some other age limits. Medicaid participants pay very little or no part of their coverage, and they receive regular dental and vision exams as part of Medicaid. Whereas Medicare, there is a deductible and you do have to pay for part of your coverage, and it's also divided into 4 separate parts, A, B, C, and D, having to do with prescriptions, dental and vision, in hospital, out of hospital, those types of things. However, both programs do benefit people with disabilities, provide prescription drug coverage, although there's a cost with Medicare, provide outpatient hospital care and inpatient hospital care. So those would be the similarities. But oftentimes those terms are tossed around interchangeably, and they're really not the same. Then other people have private health insurance. So the picture shows you different examples: Blue Cross Blue Shield, Delta Dental, Humana, United Healthcare is a big one. And so a lot of times now, companies will pay for part of the insurance, but sometimes they won't. And they have new laws that came into effect related to smaller businesses versus bigger businesses. And if you have greater than so many employees, then you must provide health coverage to them. And so one of the ways to keep costs down would be promoting health and disease prevention, and intervening early, prior to there being a problem, to help with reducing the cost. Because for somebody to be in the hospital in diabetic ketoacidosis or in renal failure costs a lot of money. But if you could do programs prior to that happening, nutrition, exercise programs, medications, then that will eventually cut down on the cost to the consumer. Healthcare reform, so the Affordable Care Act, Obamacare, so is an effort to reform healthcare. And so you have to obviously manage costs because it's a business, promote access. Again, we talked about access to healthcare. How do you access or get your healthcare, and being able to identify who can, the payers and or players, as I call them, in the system that you're going to be working with. So who can, like Blue Cross, Blue Shield, who would do that? Or would it just be the state ones? Would it just be Medicaid or Medicare? And so one of the worries when we first talked about this was rationing care and limiting coverage for specific populations. So that's why I had asked you, or I will ask you in the Healthy People 2020, what do you think about that? What do you think about rationing care? Or do you have to, what is the cost benefit? The needs of the one or the needs of the many in limiting coverage for specific problems. And so this also is sort of that same question, what are moral, ethical, legal ramifications of restricting access to healthcare or limiting coverage for specific problems? There was a talk about, providing surgeries for people over 80 or 85. Is that a wise thing to do? They're just going to die anyway. What becomes the criteria? So again, that's sort of a personal question, what you think about that. But to think about that that's one way to limit costs, is to reduce the number of people for whom you're providing care. I don't know, how would you decide? So Resurgence of Self Care, people are liking to do complementary alternative medicine. Again, the illness and prevention, a lot of families are going back to home births with midwives, which is another conversation we can have. You know, homeopathy, hydrotherapy, acupuncture, essential oils, all things like that. I like this lady here. She's doing her aquatic therapy in the water, which is a great thing to do. So, and then some more examples would be like some occupational health programs, which would be ones at work, making sure that you're providing or looking for culturally competent care in diverse populations. You know, what might work in the Hispanic community may or may not work in the Asian community. So you have to kind of take a look at that. You know, educating nurses, at different outreach programs, being able to, there was a point at which we wouldn't even as nurses, like talk about complementary and alternative medicine. You wouldn't send somebody to an acupuncturist or talk to them about essential oils or meditation. And now really that should be on your list of things because that works for some people. So they need to be aware of all of the options. So when you're talking about global health, because it's not just the United States, it's also the world, we talk about the United Nations and the World Health Organization that were implemented in 1945, 1946, after World War II. And so trying to make sure that everybody is covered, everybody has human rights, everybody deserves to have peace and health. And so these organizations were put together for those reasons. And it's been interesting during the pandemic as the World Health Organization puts out certain guidelines, but the CDC puts out different guidelines, or where the World Health Organization will change their guidelines and the CDC will do the same. So I think they're in a difficult position, but I think they're trying to do what's best. But it's hard to be in charge of the world. I mean, meeting everybody's healthcare needs. I just can't even imagine. But they're trying, and it's a start. And then when you're looking at the future of healthcare, to think about, do we want more government? If we increase the government involvement, will that help with costs? Would I be able to pay for my doctor's visits if the government had a specific program? There was a lot of growth of healthcare systems in the 80s and 90s, and a lot of those are shut down now because they've lost funding. And now during the pandemic as well, some hospitals were filled to capacity and overflowing, other hospitals had no patients. And so, or especially, COVID patients, and they stopped doing their elective surgeries. And so their census went down and they lost money, and some closed. So you kind of have to look at, well, what's the need and what's the benefit, the cost benefit? Will healthcare systems, not just an independent hospital, but like a hospital system like Kaiser. Kaiser is a hospital system. Is that the way to go? Again, I don't have the answers. These are just things to think about and see what happens in the future, what's happened in the past and what will happen. If you are into political action committees, being nurse advocate on a governmental level, a lot of nurses go to Sacramento and lobby for certain things that they would like to see happen. If that's your thing, then I think that's a great way to do it. Write to your your congressperson and your senators and the governor, and let them know how you feel about certain things, or join a political action committee or group, and get your agenda, move forward. And then I like this picture. It's the education of the nurse. So this is probably 50s or 1950s, 1960s, and they have their little apron pinafores on and their nursing caps, and it's just a very traditional picture. But what is the future of healthcare? So looking at nurses and other healthcare professionals, what support do we need? Do PT, OT, RT, do we need to move forward, to educate? COVID has also, the number of nursing students coming out of nursing school probably has decreased because many programs had to close. Hartnell was very lucky, we were able to stay open. But how can we help to provide cost-effective quality care for patients? And then how do we also take part in legislative decisions? Do we want to even do that? So I think we really have to stick together as healthcare professionals in our different disciplines and work together for ourselves as well as our patients. So that's a wrap again. Some key points for you to remember would be being able to define the difference between Medicaid, Medicare, private insurance, define the role of government in healthcare, be able to provide at least 2 examples of self-care, and then to think about where the future of healthcare is headed. Where do you see healthcare moving in the future? All right, I will see you in the next lesson.